everyone. This is Dr. Geethika Kss. I am a dental and facial aesthetician practicing as a consultant in and around Hyderabad. So today I am going to be answering a few questions. These are the 5 most asked or most sought out questions that patients ask us in regarding to their dental hygiene or the cosmetic and beauty part of their smile. So this is going to be informative to everyone. Any one of you will be able to get some help through this. So stay tuned till the end of it. All right. So we are going to go in a descending order of the questions. I'm starting from the fifth question. So the fifth question we have is, why do I need to get professional teeth cleaning done regularly? So a lot of patients who come to us, they say that they brush very well at home. They brush twice, they brush for 10 minutes, they use a lot of products. But why do I still need to go to the dentist? Why do I still get pain? Why do I still get cavities? So for this, I'm going to explain it to you. So there is a marginal difference. There's a big difference between how you clean at home as a layman and what a professional dental cleaning is. Now, as a layman, when you brush at home, you might not be able to get into all the issues of the oral cavity or the smile or your mouth in general. So now when you come for a cleaning, it is like a doorway. It is a doorway to a lot of procedures that we see, a lot of issues that only the professional eye can see. Like you might have some ulcers or something bothering you on the tongue or on the inside of your cheek, which you might not be able to see at home. Your bite might be different, your bite might be not ideal, which only the doctor will be able to see, and the smile lines, the smile difference, the cant of the smile and everything, the professional eye will be able to catch it better. That is one thing. It's like a whole, it's not only one teeth or two teeth, it's the whole oral cavity or whole mouth in general. Now, the second thing is, for some people, even though how well they brush, if a small cavity or if a small calculus or plug is already formed, no matter how well you brush, it will not go away. It has to be cleaned or it has to be addressed with professional instruments that we have in the clinic. So due to these two things, you have to, and everyone has to get a usual general dental cleaning and checkup done professionally at least once every 6 months. Or if your oral hygiene is good, you can at least try once every year. So that is our point number 5. The number 4 point what we have is, I have this brownish horizontal stains on my front teeth, like brown color, yellowish looking stains on my front teeth. So when I smile, they are looking odd and I don't like this kind of smile. So the reason for this is, some people might have this since childhood. Some people might develop it in childhood. So it can be of two reasons. One might be, it might be a birth defect in your teeth, where the outer layer of your teeth is not formed as strong as it should form. And another reason might be, some people might develop this due to water intake which is rich in fluoride. It's called fluorosis and such. So for these indications, what we do is, if the stains are in the milder side, if they are like a little bit mild, they are not that severe, there is a treatment called microabrasion, where we abrade or we roughen the top part of the teeth which contains these stains. So what we are doing here is, we are removing the stains, we are softening the stains, and the resultant product or the result of your teeth will be, they will be white and shiny. So this is used for mild cases. If the stains are towards moderate to severe, what we advise you is, you can get veneers or crown preparations, crowns done. So what happens here is, the top part of your tooth or a few millimeters of the tooth structure around the natural tooth is grinded, is reduced. This makes space for the veneer or crown to be placed onto the tooth. So what happens is, this in this procedure is, whatever brown stains are there, we are removing them and we are making place for a new crown or new veneer to sit, and the resultant product will be, it will be white in color. It will be the shade that we choose for the veneers or crowns, and it will be smooth looking and aesthetically pleasing. So that is our number 4. Now coming on to the last 3. Now third part is third question. A lot of people say my teeth are very fine, I don't have any problem with my teeth, but when I smile my gums are looking very black, my gums are darkened. I've had such since a long time. So what can I do to get rid of these blackened gums or darkened gums? So for in this case, what we say is, you have to understand that this is caused due to the melanin pigment in your body. This melanin pigment is responsible for our overall skin tone, for the thickness of our hair, and it is also responsible for the color of the gums that you have. So for this, we can tinily we burn away or we scald away the top portion of the gums that is showing here with an instrument called laser or like laser pen. So we remove the top part which is pigmented, and the underlying healthy gums, pink gums, are visible to the outside when you smile. Now you have to understand this may be a temporary procedure. There might be a reoccurrences for few people. So if you have some major event like wedding or anything, you can get this treatment done a few days or weeks before that event. That is our number 3. Now next, number 2 is I have gummy smile. A lot of my gums are shown when I smile like this. A lot of your gums are shown. So what we can do for this? Usually the ideal thing is when we smile, a few, a few of the teeth should be visible. Now for some people when they smile, you might have seen in your friend circle or anything, a lot of their gums and a part of their upper jaw is also visible, like the upper lip pulls up very high, like when you smile it pulls up very high, and their gums are visible, their upper jaw is also visible. What can we do for this? This procedure or treatment that we have is comparatively new. It's called Botox or botulinum toxin injections for gummy smile, where we place a few units of this Botox here and here. It is the area where all the muscles which are pulling your upper lip up meet. So what happens here is the muscles that are pulling the upper lip are relaxed. Their action is a bit relaxed. So when you smile wide, your upper lip won't go as up as it used to go before, and it will fall down. And when you smile, only the amount of teeth that we want will be visible, which is again aesthetically pleasing. So that is our number 2. Coming to our number 1 and the most asked question, teeth whitening. I have yellowish teeth. I want one shade lighter or whiter teeth. So a lot of people mainly come with this complaint, and these people, they have the yellowish stains due to many caffeine intake, sodas or whatever, and sometimes maybe due to poor oral hygiene also. So what we do in this case is we place something called a bleaching agent onto the front teeth, which are visible when you smile. This bleaching agent reacts with the chromatic particles or the particles that form this yellowish stain on your teeth and removes the particles. So we place the bleaching agent, we leave it on the teeth for around 15 to 20 minutes, and right after it is washed off, right after we remove it, you can see an immediate change in the shade of your teeth. Your teeth will be one shade whiter. So this is how our bleaching or teeth whitening procedure is done. Some people might require 1 or 2 sessions for it, but it is a very good and long lasting procedure. So those are our 5 usually asked, most sought out questions from our pain to the beauty or cosmetic part of your smile. Now, I hope any one of this was helpful for any one of you. And if you like this, please like. And if you have any more questions, you can comment down below. And you can follow us on Instagram and on YouTube. Thank you very much.